All right. I just want to thank everyone for joining us tonight. We are here to talk about Medicare tonight. And we are recording this just so we have the opportunity to put it on our website so people can check this video out if they missed our Zoom chat tonight. And we have Roberta Eckert here with us tonight. She is the Vice President of Nationwide's Retirement Institute, working with the Insights and Solutions field team. She joined them in 2013 and has been in the financial services industry for over 28 years. She's frequently sought out by the media, including Kiplinger's Wealth Advisor and CNN, for her insights with Social Security benefits and financial issues facing women. So take it away, Roberta.
Thank you, Adam, and thank you, Christina and Heidi. And thanks for letting me spend a little bit of time with you talking about Medicare. So I just want to let you know that I am broadcasting from lovely Hartford, Connecticut at the Marriott, which is why you have this lovely view behind me. But in the interest of technology, I am going to take myself off video because I always want to make sure, at least I hope I am, I always want to make sure that we have enough bandwidth to share the slides and this information with you. So just give me a moment there. Excellent. So thank you again. I work for a group at Nationwide called the Nationwide Retirement Institute, as Adam said. And our role really is to help people break down and simplify a lot of the complex issues that revolve around retirement. And these are things that are over and above, you know, saving for retirement, making sure that your risk tolerance is accounted for, making sure that you have your assets allocated the right way that Heidi and Christina and Adam deem appropriate for your situation, all those kind of money things. But when it comes to retirement and it comes to things like Social Security claiming or healthcare claiming or Medicare or taking money out of your retirement assets in a most tax effective way, we have created a lot of content around that. So I am delighted to be able to share this with you this evening. As you start to become retired, I guess, or work, go down that path, we do a presentation that talks about a bit about healthcare costs. And that really is something that talks more about the fact that healthcare is going to be a large expense when you're retired, and that you probably want to be contemplating what that might look like sooner rather than later, because it's also an expense that's going to last for the longest period of time. Then, as you get closer to 65, we wanted to create something because we had so many people asking us if we could elaborate a lot more about Medicare. And so hence, we have this particular presentation. So with that, I wanted to also let you know that at Nationwide, and yes, we are the Nationwide is on your side people, we actually have a whole group that is called the Nationwide Financial, actually it's just called Nationwide Financial, as opposed to the property casualty side, which is car insurance and those kinds of things. Now, our group is working very diligently with financial professionals, with plan participants on the retirement plan side and all this sort of thing. And as such, we have also created a lot of investment products, but we are not going to be talking about any of those investment products today. What I am also going to avoid doing is talking to you about any legal advice, accounting advice, tax advice. If you're looking for financial advice, you are in the right place, because that's where Heidi, Christina, and Adam, and your advisors at CWM, are going to step in and provide you with that super important financial advice. So I guess the bottom line or the takeaway is, although I have been licensed to be a financial advisor, I'm not your financial advisor. And really, we created this presentation tonight to provide you with further education. And if it's like anything else, Medicare being no exception, there is an information overload. I mean, you know, with the advent of 24/7 news cycle and the internet and all kinds of different social media platforms, there is just so much information, not all of it accurate, that you're exposed to. And when it comes to Medicare, when you start to approach age 65, you are going to see that kind of information overload mostly attached to your physical mailbox, because you're going to get information from the federal government. You're going to get information from insurance companies. You're going to get information from just about anybody that might have an interest in selling you something to do with Medicare. And so we'll walk through what those differences are. To be clear, Nationwide does not even have any Medicare products. So even if I wanted to talk to you about Medicare products provided by Nationwide, I couldn't. There's no such thing. In fact, as I love to say, we actually do have healthcare coverage for one of the most important members of your family, and that is the furry, the feathery, and the scaly members, because we are the #1 providers of pet insurance. And Dolores, I heard Christina ask you about your cat, so I want to see your cat before we hang up tonight. But when it comes to humans, the fleshy kind, we do not have insurance for you. Again, here to provide you with education, and just as importantly, to cut through a lot of this information overload. So with that in mind, here are the 3 main topics we're going to talk about for our time together. What is Medicare? When do you enroll? In fact, I did a presentation this afternoon on the exact same topic, and people said, well, what if I'm on Medicaid? And so we'll cut through what those differences are. Then we're going to swing over to going through those different moving parts of Medicare, what they cover and how much they cost, and then look at alternative options, things like Medicare supplement policies. And what about Medicare Advantage plans? You know, in my market, I see Joe Namath on TV all the time talking about Medicare Advantage plans and how you can save money in Social Security and get money back in your check and all this sort of thing. And so what's that all about? So we'll make sure that we spend some time on that too. And then just like anything else, there are a few takeaways and some next steps we'll share with you that Christina and of course Adam and Heidi can follow up on. So with that, let's get started. We at Nationwide did not go this alone. I mentioned that we don't sell Medicare plans, and consequently, when it came time to figure out next steps and the content I'm going to present to you today, we did rely on a group called the National Council on Aging. We're real tickled to be partners, if you will, with them, because they are a nonprofit organization whose primary objective is to help seniors age with dignity. And they do a lot around this topic. In fact, they've created a tool that we could make you or avail you of to help cut through a lot of the Medicare decisions that are on your plate. And we'll talk about that in a little while too, if you'd like. So first agenda item, what's Medicare? Pardon me. And when do you sign up? Well, first of all, Medicare is not Medicaid. Medicaid is a federal health insurance program that is available to people at poverty levels and below. And probably nobody really aspires to that, but sometimes it's unavoidable. Medicaid would require you to give up a lot of your assets. If you intentionally give up your assets with the intent of ultimately qualifying. Oops. I'm hearing some. So I think there we go. I wanted to make sure everybody was muted. So if it's your intent to qualify for Medicaid, they're going to look back and see how long ago you started doing that to see if that was your intention. But tonight, we're not talking about Medicaid. We are talking about Medicare. And this is a federal health insurance program also, but not for indigent or people at or below the poverty level. This is for people who are 65 years old or older. And once you hit 65, regardless of your gender, your income level, and your health condition, meaning you could have several conditions that would be thought of as pre-existing conditions. But once that's the case, you are eligible for Medicare. And also, if you are collecting Social Security or railroad retirement benefits, I'll tell you what, that's a little tricky to say. Say that 3 times fast, railroad retirement. If you're collecting Social Security or railroad retirement benefits, they will automatically sign you up for Medicare. Also, the other qualifications is that you're currently a resident of the US or a citizen, and you've lived here for 5 years or longer. You could be eligible for Medicare under the age of 65. I do not wish this on anybody because it means you've got some serious health conditions. You might have been collecting Social Security disability or railroad disability for at least 2 years. If you have ALS or end-stage kidney disease, you could sign up for Medicare before you're age 65. That's not a trade-off, as I said, I would enjoy, and probably you would not either. So let's stick with the 65-year-old age. Once you're 65 or approaching 65, you have what is, in my opinion, a pretty generous 7-month initial enrollment period. So you've got this 7-month time frame where you can sign up and avoid any kind of penalties. That's something else that we're trying to achieve with our presentations, is make sure that you don't make a misstep that would result in penalties that would be stuck on you for a very long period of time. The initial enrollment period begins 3 months before your birth month. It includes your birth month, and it ends 3 months after your birth month. My birth month is July. So theoretically, I could still be signing up for Medicare, get covered, no penalties, no concern about any pre-existing conditions. In fact, I could have signed up as early as April. And if that's the case, I would have started my coverage on July 1, even though my birthday is not till late July. So you have a pretty healthy enrollment period in which you can sign up for Medicare. We also get quite a few questions almost every single time. Well, what if I'm still working at the age of 65 or older? And trust me, we will cover that before we're done, but I want to go on with a few more things as we get further into our program. One thing I will say, though, is that if you are still working after 65, you probably want to go to your human resources department, or if you're covered by your spouse's plan at their job, they would want to check in with their human resources department and see how the benefits would coordinate with Medicare. So generally speaking, and we always say, verify this, don't just take my word for it. But generally speaking, for a company that employs fewer than 20 people, the human resources folks would probably tell you that Medicare would take first priority, and the insurance that they carry on you would be a secondary or backup coverage. If the company employs 20 people or more, then the health insurance that they are providing you with is probably going to take the first line of defense, the priority. And then if you do sign up for Medicare, it would probably act in a kind of supplemental format. So your question is to yourself, well, should I stick with my employer coverage, or should I enroll in Medicare, or is there any benefit to be had by combining coverages? And I will tell you this, when you're 65 years old and Medicare eligible, if you are covered by job-related healthcare insurance, then that's what's typically known as creditable coverage. And you do not have to sign up for Medicare. In fact, you can trudge along, get covered, or continue to be covered by either your job-related healthcare insurance or your spouse's. But then when you are no longer covered by that plan is when you have a new enrollment period. That is called the special enrollment period. That lasts for 8 months. And you have 8 months to sign up for Medicare during that time frame in order to avoid any kind of penalties and so forth. So again, a pretty healthy time frame where you could sign up. One last thing about this. If you are contributing to a health savings account, an HSA, then if you enroll in Medicare, even if it's just Part A, then you can no longer make any further contributions to your health savings account. So you could certainly remove money from your health savings account. And these are accounts that have been set up to pay for qualified medical expenses. But if that's the case, then you can no longer contribute. If you're signing up for Medicare, of course, you could take money out to pay for those qualified medical expenses. So lots to think about there, but just wanted to point out that if you are covered, you're still working, and maybe you're going to leave your job and sever service at age 68, then that 8-month special enrollment period will begin, and you've got some time to sign up for Medicare then. All right, so you've signed up for Medicare, or you're trying to. What happens next? And one thing you'll find is that there are some differences between Medicare and the coverage that you are probably used to through either your company or your spouse's company or other forms of health insurance that you've had. And I'll try and point those out as we go through this next section. There are two ways that you could get Medicare coverage. The first way is through original Medicare. Anytime you see an orange chevron, I think they call it, down there at the bottom, that means that you are now getting some kind of insurance provided by a private insurance company. Anytime you see navy blue, that means you're getting coverage by the federal government. So with original Medicare, they are providing hospital coverage and medical coverage. That's Part A and Part B. And because there are some things that are not covered by Part A or Part B, then you want to look at Part D and sign up for something there that is a prescription drug plan, and probably want to layer a Medigap plan on top of that. And that is supplemental insurance. Sometimes it's called a Med Sup plan, sometimes a Medigap plan. But either way, we're going to take all four of these components and break them down in some further detail in just a moment. Before we do that, we're going to look at Medicare Advantage plans. And these are plans offered by private insurance companies like Cigna, Blue Cross Blue Shield, United Healthcare. And they've gone to the government and they've said, hey, we want to offer Medicare-like coverage to people within our network. And the government says, well, okay, you can do that, but you must provide your clients with everything that's covered under Part A and Part B. Original Medicare, that's the part on the left-hand side, is a coast-to-coast network. I used to say I should say national network. I used to say a nationwide network, and then I had to quickly correct myself because it's not nationwide like my company. It was nationwide like coast-to-coast. So if you sign up for Original Medicare, that means that you have access to any facility or any physician or any provider that accepts Medicare patients. On the right-hand side, one big difference is that your Medicare Advantage plan is typically a regional plan. It is limited to a geographical network, and very often you would also need a referral to get either a treatment or a procedure done. Now, the trade-off there is that premiums are often quite low. In fact, people sometimes tell me we pay nothing for Part C. And of course, just like anything, there is no free lunch. So there's some things there that maybe are being accommodated for in the spread. In other words, maybe a physician will accept so much payment for a treatment, and then maybe it's not all or maybe you would pay a little bit more for that treatment, for example. So there are pluses and minuses, I guess, to both. I have sent to Adam a couple of pieces that he can share with you after this presentation that's going to help formulate your decision. And again, remember, we've got a tool from National Council on Aging that should be helpful to you. But for now, what I want to do is go through the left-hand side in a little more detail. And we're going to start with Part A, and Part A is going to the hospital. And if anybody's been to the hospital, you will relate to what I'm going to share with you in just a few moments. So Part A, you're going to the hospital. Your Part A is going to cover your stay there. If then later you go back to the doctor for a checkup, that's going to be covered by Part B. Part A is also going to cover skilled nursing facility care up to 100 days if, and this is a big thing you want to look out for, that if you have been admitted, not placed under observation, but admitted for 3 nights, not days, 3 nights or longer. So if you've been admitted to the hospital for 3 nights or longer, then Medicare Part A would kick in and pay for you to stay in a nursing facility for up to 100 days. There's some other qualifications there. So we have saved people a ton of money sometimes where they've taken a loved one to the hospital and they've insisted on that individual being admitted because otherwise they might be there for 2 nights and or they might be there for 3 nights, but only one of them was being admitted. Also, hospice care for end-of-life comfort and home health care if it has been prescribed by a physician, so under some limited conditions. But one thing that Medicare in general does not cover, and that is long-term care or an extended care event. 64% of people that we polled think that Medicare covers long-term care. It does not. It would cover skilled nursing facility for up to 100 days. 100 days is nowhere near considered long-term. So that's how Part A works. Often when I do this presentation in person, I'll ask people, do you know what you pay for Part A? And I'm going to take a risk here, it's the end of the day for me, as is for you. So I'm going to tell a little, maybe a joke. But anyway, so I will say to these people, do you know what you pay for your premiums on Part A? And they'll say it's free. And I say, no. You never use the word government and free in the same sentence ever, because it just doesn't work that way. But if you've worked for 40 quarters or more, and those quarters do not have to be consecutive, then you will pay no premium for your Part A because you've been paying it all along. It's never free. Also, if you have worked between 30 and 39 quarters, you'll be paying something out of pocket for your Part A. But if I've worked for 39 quarters, I know that Adam, Christina, and Heidi are going to say, look, get back to work for a couple of quarters, because that is going to save you in excess of $2,700 a year. Because once you flip over into 40 quarters or more, your Part A is going to come to you at no cost once you're retired, because you've been paying for it. And then if you work fewer than 30 quarters, then you would pay an even heftier monthly fee. Now, even if you're one of those folks that pays nothing for your Part A premiums, that does not mean you're off the hook. You're still going to be subject to some copays and some deductibles. And we'll get into the money part right after we look at Part B. Part B, and we're still under original Medicare, Part B is medical coverage. And this list here is by no means fully comprehensive. You can look online and see what else Part B covers or doesn't cover, but essentially it's going to the doctor. The doctor and physician ambulance services, provided it's an emergency. Durable medical equipment, outpatient, you can read as well as I can, but that's Part B. And also preventative benefits, although some of those are provided at no cost because they are preventative. But let's take a look at the money part of all this. And we'll start with B, since that's where we were. Part B is going to be, you are going to be assessed a premium for Part B, and it is going to be contingent upon what your, informally, I'll use the term taxable income. It's going to be contingent upon what your taxable income was 2 years ago. So don't be alarmed though, because if your taxable income was higher 2 years ago, and then as you gradually maybe have less and less income, your Part B premiums will also change every year to reflect that new income level from 2 years earlier. Put another way, once you have signed up for Medicare and you've signed up for medical coverage, Part B does not mean that the premium that you have set is the one that's going to last you for the rest of your life. But I will tell you one thing, and that is, if you look in that middle column where it says married income, if you have a spouse and you are married filing jointly, and you have a taxable income of about $182,000 or less, then each of you on a monthly basis will pay a little over $170 for your Part B premium. But look at that next row. This is very important to know. If you have a taxable income of let's put it this way. If you have a taxable income of $1 more, $182,001, now each of you is going to pay on a monthly basis an additional $68. Put another way, that one extra dollar of taxable income just cost you and your spouse about $1,400 in excess premium to get the exact same coverage that you would have gotten for the $1 less. And that's where your advisors at CWM are going to work with you and say, look, let's see if you need more income over this $182,000. Maybe that's where you tap into your health savings account. Maybe that's where you go to your Roth. And by the way, 15% of your Social Security check is tax-free. So there's that. But I do want to let you know how that works. There's that 2-year look back. One last thing is that if you are collecting Social Security, your Part B premiums will be deducted from your Social Security check. So if you sign up for Medicare and you've signed up for Social Security and suddenly, or let me put it this way, let's say you've been claiming Social Security and then you go and sign up for Medicare and you see a drop in your Social Security check, this is probably going to be why that is. Also, Part A, there's some money parts you want to be aware of here as well. And this is one of those things that's different from healthcare coverage you might be used to while you're working. And that is, this deductible under Part A is per benefit period, not annual. So we'll look at a picture about that in just a moment. There are some additional copays. There's some copays for skilled nursing facilities. And you also have 60 lifetime reserve days, sort of like get out of jail free cards that you can use at the hospital that you can utilize at the hospital. But once you've gone through that, then you're going to start paying out of your own pocket, unless you have a Medigap plan. Because here's another difference from healthcare that you might be covered under right now. When I look at my policy that I'm covered by under my nationwide policy, I have family coverage for myself and my husband. And once I hit a certain amount that I have paid for out of pocket, that could be for prescriptions, my copay at the doctor, whatever it is. Once I've paid X number of dollars, my insurance coverage says, all right, Roberta, you've done enough. Step aside. We will take every dime from here on out to the end of the year. So put another way, there is a cap on how much I would pay out of pocket for my healthcare in any given year. Medicare has no such cap. Advantage plans might, but original Medicare does not. Look at Part B on the right-hand side. That annual deductible is annual, pretty tolerable, about $20 a month. And also there's a 20% copay of Medicare approved cost for covered services. So not unlike what you might be familiar with right now. And I promised I'd come back to this benefit period. This benefit period, shortly or simply put, is 60 days. If I'm in the hospital for however length of time, and then I come out of the hospital, and now I'm out of the hospital for 60 days or longer, and then I have to go back into the hospital, even if it's for the same malady, then I'm going to have to be faced with that deductible again. So it's per benefit period. Think of a benefit period at 60 days out of the hospital. And remember, it is not an annual deductible. So in the material that Adam can provide to you, we also have this chart here. It just lays out those co-payments and lifetime reserve days, after which, again, you pay 100% of your hospital stay. So do know that after the copay and deductible and lifetime reserve days, you might have some expenses that you would be paying for yourself. So we have now left the wonderful world of original Medicare. That's A and B. And it's important to know that there are a couple of add-on components to A and B that you really want to make sure you're aware of. And one of them is a Medigap plan. These are plans that have been standardized by the government. We'll see a chart next, but they are going to pay for services approved by Medicare. If Medicare doesn't approve it, your gap plan will not cover it. So it's not going to pick up everything that Medicare won't pay for. It's only going to pay for some things that Medicare approves but doesn't pay for, like that 20% copay. When I go to the doctor, let's imagine that my doctor bill is $200, and under my insurance right now, I've got a 20% copay. So that means that I would pay $40. Well, the whole visit's covered, but my insurance is not paying all $200. And that is very much how this works as well. There are 10 standardized Medicare supplement policies. And you can see they are all lettered here. They, when I mean that they're standardized, that means that if I have Plan G, look at Plan G and look at that column there. If I've got Plan G in Virginia and my sister has Plan G in New York and my other sister has Plan G in, I don't know, South Carolina, we would all get this exact same coverage. Somewhere about halfway down that row, you'll see Part A deductible. Remember that $1,500? Plan G is going to pick it up. You know that Plan B deductible, $233? It's not paying for it, but admittedly, it's only $233 annually. What about your Part A copay and hospital costs? Part G is getting that at 100%. Whereas if you look at the Part B copay or coinsurance, Plan G would pick that up 100%, but K, as in kite, does not. So we would get the exact same coverage, but because these plans are offered by private insurance companies, I could pay more or less than my sister in New York and my sister in South Carolina. Because again, I might have my Plan G through Optum, she might have hers through United Healthcare, and it's whatever the market is for in that particular area. You might have friends or neighbors saying, oh, go with F. F is the most comprehensive. You ought to sign up for F. Well, unfortunately, F is no longer available to new enrollees after January 1 of 2020, nor is Plan C. But for those people that enrolled before then, they can still stay there. So you can see what it's covering there, quite comprehensive coverage. And then I also want to touch on Part D. If you think D for drug, then you've got it. And Part D is a little interesting because, again, provided by private insurance companies. And if it were me, I would sign up for Part D when I signed up for Medicare, because failure to do so could result in a penalty that by and large would last you for the rest of your life. So Part D is drug coverage. And what you could do is get on the National Council on Aging site and type in what drugs you take, line up your prescription bottles in front of your computer screen, type it all in. And what will come up is the Part D plans that are available for you and what they would cost. But by all means, I have two thoughts for you. One of them is review it every year, because the plan that you might sign up for in any given year might cover name brand drugs. Throughout the year, you might be prescribed something different. The plan might change and now only cover generic drugs. So you definitely want to review it every year doing open enrollment, which begins in about a month on October 15th and ends on Pearl Harbor Day on December 7th. And it will come as no surprise to you. All you have to do is drive around your neighborhood or your commercial area of your town, and you'll see like CVS or Walgreens has a sign out front that says, you know, have you signed up for Part D yet? Come in and find out what ours does. So that's what you want to do. And you also want to sign up when you're eligible, because as I mentioned a few moments ago, failure to do so could cost you 1% per year for every month you did not sign up, but you should have. And this chart here is simply showing you that in addition to Part B, these IRMA surcharges, IRMA is simply an acronym that stands for Income Related Monthly Adjusted Amount. Those surcharges based on your taxable income will also apply. And each year they can be more or less depending upon your level of taxable income. So you've had 4 different components of the left-hand side of the chart. And before I leave this, I do want to point out what's not covered, because I've said probably 6 or 7 times, Medicare doesn't cover everything. So what's not covered? Dental, vision, hearing. Very often, those are included in a Medicare Advantage plan, but you also want to make sure you do your homework, because an Advantage plan might say, oh yeah, we've got dental coverage, but if you dig a little deeper, you might find that it's limited to maybe 1 or 2 cleanings a year. So just do a little research. The folks that we can put you in touch with at National Council on Aging can help with that as well. Alternative medicine, I mentioned long-term care received outside the US, non-emergency transportation. If you want to know more, you can go on the Medicare.gov site and find out what's not covered. by A and B on original Medicare anyway. One or two final thoughts about C, or the Advantage plans. I've been referring to them as we've gone along, are these. I mentioned that they cover the same services as Medicare. They can't deviate from that, but they will often include other things like, as I just mentioned, vision, dental, and hearing. Almost always they will include a prescription drug plan, and the copay, unlike being standard like 20%, it's going to vary by service or by treatment. And also it might have limited geographical coverage. I was working with a couple once in Houston, and they said, well, we live part-time in Houston, but we also have a home in Colorado. Should we sign up for a Medicare Advantage plan? And I said, well, I'm not your advisor, so of course you want to talk to them in a little more detail about how long you spend there and so forth. But if you fall ill in Colorado and you've got an Advantage plan that covers you in Houston, you might find that being out of network is going to cost you dearly. However, the premiums can be quite low. So I can't really tell you, much as I would love to, which is better. What I did want to do was at least bring to your attention some of the differences between original Medicare, Medicare Advantage, and also some of the differences between Medicare and the health insurance coverage that you've probably been familiar with for all your working years. So before we hand it back over to Adam and see what questions you are, there are a few last things I'll share with you. These are just recap things. Medicare is a federal health care system that is providing you with health care once you are 65 years old or older, and it is not free. If you're collecting Social Security, if you are collecting railroad retirement benefits, then you will automatically be enrolled once you hit 65. Everybody else, you have to be proactive and you have to go and sign up. And you've got a 7-month time. That's IEP, stands for initial enrollment period, or you could face a penalty, particularly for Part B and D. Next, you have the selections between A and B, D, remember D for drug and a gap plan, or a Medicare Advantage plan. Original Medicare has that national network, but doesn't cover everything, as we just saw in that prior slide, whereas the Advantage plan often has a limited network, but might have more stuff that it covers. So what do you do next? Well, as we always say, you want to start the conversation with your advisors at CWM, and Heidi and Christina and Adam are familiar with our programs, and they can help guide you. They know where to go in case there are questions that might entail us needing to kind of have a conversation as well. But whatever it is, just know that you have got some really great resources at your disposal as you kind of navigate through these decisions. It's complex. There is no doubt about it. I've gone through a lot of information. I hope I haven't confused you terribly. But if I have, I hope, then I apologize. If I haven't, and you still have questions, by all means, feel free to ask. I'm going to turn it over to Adam. And or if you have questions that are more of a personal nature, Adam and I, or Christina and I, or Heidi and I, we can all talk offline as well about that if you prefer not to divulge all of your medical situation here with all your brand new best friends. So Adam, I'm going to turn it over to you and see what's come in while I've been sharing this information with you.
Great. Thank you so much, Roberta. That was just a treasure trove of information there. I know it's never easy for anyone trying to navigate Medicare and all the different pieces and how they work and all the timelines. But that was fantastic. I know there's usually a couple questions around this, so I will just kind of toss it out there. If anyone has a question, just feel free to kind of raise your hand or speak up. We don't have the chat function, so feel free to just ask away and use Roberta while we have her here to help us.
Well, I will get the ball rolling with a question. So if you qualify to have Medicare cover the first 100 days in a skilled nursing facility, is there a maximum on how much they'll cover for that? Other than I know that after a certain number of days, then you pay a deductible type of thing, or a copay, but do they have a limit on what the
Not
cost
that
can
I'm
be?
aware of. That's a great question. I don't believe so. However, I will say that the way Medicare works with facilities and physicians and providers is that those facilities, provisions, and providers and places, they have negotiated with Medicare, and if they accept Medicare patients, they agree to be paid what the Medicare amount is for that procedure, service, or stay in the facility.
Okay. I was
So
wondering
it's
if it was
pre-agreed.
working out the same way. Yeah.
Yeah, it's a pre-agreed amount. And if I'm, physician Eckert, and I've got a Medicare patient and they come in for something, I agree to accept the payment that Medicare, I agree to accept the payment that Medicare wants to pay me for that treatment.
Okay. And of course, the care can be different at different facilities.
Yeah, sure.
I think Heidi has a question.
Yes, I had a quick question. We have a lot of clients that are snowbirds. They live in 2 states. Clients that happen to live here or Arizona or California, they always go somewhere warm, and they have an Advantage plan. Is the Advantage plan tied to where they declare residency if they in fact live 2 places?
Yeah, it will. And again, because so many Advantage plans are different, because it's not a federal program. There's so many moving parts there. What we would always suggest is, take a look at the plan. But generally speaking, yes, it's tied to your state of residency. And then if you go out of network and fall ill or need a treatment or something like that, then it could be quite costly.
So
But
nobody
yeah.
accepts assignment? It's all negotiated with Advantage?
Usually, yes. Now there might be some scenarios where, if there's an emergency, the Advantage plan might pay. They might have riders that would cover you in the event that you are 6 months in Arizona. It's on a case-by-case basis. So, but I will say that Advantage plans are getting more flexible.
Great, thank you.
Sure.
Anyone else have any questions? Debbie?
Okay, so it was news to me that you have to have worked for a certain number of quarters in order to qualify for Medicare. I thought that was true of Social Security, but not of Medicare. So is that per individual, or do couples, like if you file jointly, does that affect that at all? Or
Oh, I'm glad you brought that up. Yes. So yes, it in fact is very much a parallel to Social Security. So I'm going to go on my Social Security riff for just a quick sec. On Social Security, if you have worked for 40 quarters or 10 years, you are known as fully insured. And that means that you can start claiming Social Security benefits based on your work history. You might also be eligible for Social Security benefits based on a spouse or a former spouse or things of that nature. Medicare works in very much the same way. If you have worked for 40 quarters or 10 years, and they don't have to be consecutive, then you are eligible for Medicare without having to pay a premium for Part A. Everybody's eligible for Medicare at 65. It's just how much are you paying for Part A? And so if you are married and your spouse is 65 and you are 65, you could be covered under your spouse's Medicare plan. And that was one thing I neglected to mention, and I apologize, is again, here's one difference from healthcare coverage that people are very familiar with during their working years. I'll use myself as an example. My husband and I are covered under a family policy through Nationwide, and that coverage is for both of us. We have the exact same coverage, copays, deductibles, all that sort of thing. We've got a shared copay, or pardon me, a shared deductible, for example. But when it comes time to be Medicare covered, let's imagine that he and I are both exactly the same age. We're 65. He signs up for Medicare. I'm covered under his policy, if you will, but I could select a Medicare Advantage plan. He could go with original Medicare. So we don't have to have the exact same coverage. Now, let's change the ages a little bit. Let's say that I'm 65, that he's 65 and I'm 63. I couldn't get covered under his plan until I myself turned 65. So I would have to seek coverage, either go to the exchanges, or I'd have to get insurance coverage from some other source.
Mhm.
So Roberta, to follow up on that, say I am 65, but my spouse is 62, but I have never worked outside the home. What happens when I turn 65?
Then
Or-
you, yeah, so then you could, well, is your spouse working?
My spouse was working, they met the 40 quarters, but I have not met the 40 quarters. Do I
Okay.
am I still eligible for Medicare with no premium? Medicare A?
No. So let's kind of rewind that a little bit, or as they say these days, unpack that.
Yeah.
So if your spouse is 63 and they are working, it could be that you're covered under their plan at work. That might be the most ideal scenario. But let's imagine for some reason that's not the case. In that case, you sign up for Medicare, you pay those premiums for Part A. Then when your spouse is 65 and they've met those quarters of coverage, coverage of work, then you could go under their Medicare plan and not have to pay a Part A premium.
Interesting.
Yeah, isn't it?
Hmm.
But again, if you've got a spouse that's working, my initial thought would be, we'll get coverage from their health plan at work. And again, you'd want to see, how comprehensive is it? And some people say, all right, I'm still working, but I'm 65. Why don't I just go ahead and sign up for Part A, get that extra layer of hospitalization coverage? Because I've worked those 40 quarters, I don't have a premium. And I'd caution you again about that, because if you are contributing to a health savings account, you can no longer contribute to the HSA once you have started Medicare coverage.
Yeah, that's
So
an
if
important
you
consideration.
I'm sorry, did somebody say something?
I think it was like,
An important consideration.
Yeah.
yeah,
So I was going to say, to tie it all up in a bow here. So if you don't have the 40 quarters yourself, you either want to be on a spouse's current insurance plan through an employer, or hope that they're older than you and hit 65 first. Otherwise, you're paying the Plan A premiums.
correct.
Okay.
And I don't want to be facetious, but you could go to work and like get your quarters, not an alternative for everybody. I'm just thinking of every option.
Right.
Another
Yeah.
question. So are those quarters full-time? Do they need to be 40 hours a week?
There is a minor dollar amount that you get paid in each quarter. It's low. Frankly, I don't have the number right now. So, but it's not a big number. Does that answer your question? So in other words, it's not like each quarter you have to have made $10,000. Nothing like that.
Oh, okay.
So the income level that's attached to each quarter, very low, but it's not zero.
I just did a quick Google search. It's about $1,500.
Thank you, Adam. Now we are all in the know.
Okay, and as long as you work enough to make that amount in a quarter, that's considered your
counts.
quarter?
Yep.
So you could potentially have a part-time job.
Absolutely.
Okay, all right.
Absolutely. Yeah. So again, if I've worked 38 quarters and I'm Adam's client, and I come in and say, hey, looking forward to, Medicare in a year or two, I'm pretty certain Adam would say, go get a part-time job and get paid $1,500 a quarter for 2 quarters. And then you'll qualify for Medicare. You'll save yourself easily that much, every year. Unless
It's
my husband's.
certainly worth it. And I think if people, Even minimum wage jobs, you can rack that up in no time.
Mhm.
Yeah, and 40 quarters works out to be about 10 years, if I remember correctly, right?
Yes, that's correct.
Yeah,
Yeah, 10 years. And again, they don't have to be consecutive quarters.
it's just over your lifetime. So, if you had a job as a teenager, then that would have counted towards that.
As
Yeah.
long as as long as your employer reports to the
Yeah, as long as
government.
it wasn't under the
Yeah.
table, which is not allowed.
Okay,
Yeah,
how
you
do
can-
you find
you can
out
check.
what the government thinks you worked in your lifetime?
Yes, you should always review your social security
Yes.
statements for accuracy.
We suggest that all the time. And at the risk of being too forward, if one day you would like to invite me back to talk about Social Security, I'd be delighted to do that.
Social security is another hot topic.
Yes.
For
It sure is.
You know we will.
Yeah.
That'd be fun for me.
Any
I-
other questions? Oh,
I do have a question. You talked a little bit about, Medicare versus someone that was still working, one being primary, one being secondary. And that also the number of employees at your company plays a role in that too. Could you kind of go into that just a little bit?
So let's imagine I'm 65 years old. I'm Medicare eligible. I'm still working for Nationwide. I intend to till I'm, 68 years old, say. So now I'm 65 and I have some choices. Do I stay with my insurance coverage at Nationwide? Do I scrap that and sign up for Medicare? Or is there some combo deal that would be appealing to me? Well, the first thing I'll do is say, how many people does Nationwide employ? Well, we employ like 30,000 people. So that barrier or that box has been checked. But if I work for a company that employs fewer than 20 people, my HR people will almost always say, and I always like to qualify that with an almost always say, sign up for Medicare. That's going to be your primary insurance. And then if you still want to carry insurance through the small company I work for, they would act as secondary. Now, in my Nationwide example, because I work for this giant insurance company, I would say, okay, well, I can stick with my Nationwide coverage because they employ so many people. So the Nationwide coverage would be my primary insurance. And then maybe I would want to sign up for Part A because then I get that extra layer of hospitalization coverage. I'm paying no premiums for it. But then there's that part of the HSA contribution as well. So, but we always suggest to people that if that's the scenario, then maybe they should go to their HR department and make sure that they've got it kind of straight.
Okay, so the kind of the general rule of thumb is if it's a larger company, your current health insurance is going to be your primary still.
Exactly, Adam. Yeah,
All right, thank you.
sure.
Yeah, in fact, I mean, isn't that a Medicare requirement that Medicare is always secondary if you have some other kind of insurance, health insurance?
Well, if again, the company meets that number of employees.
Right.
And well, I don't want to say many do. I don't know how many companies in the United States, what percentage have fewer than 20 employees. They're small companies around, my local plumber, my HVAC guy, my hardwood floor guy. Those all are small businesses. My veterinary person, I was going to say vet, and I don't want to confuse that with like veterans affairs. My vet probably, she might be on the bubble. I don't know how many people she hires. She's my good friend. I should know this. But anyway, so yeah, so that's kind of their trigger, meaning the Medicare trigger.
So I was trying to get my head around which is Medigap and which is Medicare Advantage and what the differences are. So it sounds like Medigap is kind of like just in between a couple of things there, you would also have to get Medicare Part D and so on and so forth, but Medicare Advantage is more expansive than that.
Yes,
Med-
that's a great way of putting it. Yep.
Okay, so does Medigap have the same kind of limitations that it sounds like Medicare Advantage might? If you are residing in multiple locations? Like out of net, would you have to worry about being out of network if you had a Medigap plan and you moved, between Florida and Vermont or something like that, part-time
No.
during the year?
Yeah, no, you wouldn't have to do that. Because Medigap is considered, even though they're covered by private insurance companies or offered by private insurance companies, they are national plans.
Okay, but as soon as you get into Medicare Advantage, then you have to worry about, we've had a lot of issues this year with in-network, out-of-network, because the hospital system here in Vermont was kind of, playing chicken with United Healthcare. So for a while there, we weren't sure whether we were going to be in or out of network because insurance
But that's
happens.
that's not Medicare though. That's
No, true, right. But the same thing I potentially could happen, I would think, with a Medicare plan, one of those Medicare Advantage plans. So I'm just wondering what your risk would be of all of a sudden finding out that you're out of network because, you're no longer in the state that you took out the insurance in because now you're spending the summer in, some other location.
Yeah,
So
and yeah, go ahead.
I was just going to say, so Peter, as you approach that time, one of their tools is being able to put in your prescription, not only your prescriptions, but also your to check out your providers.
Yep.
To see, so you can check like Florida and Vermont to see if they're on there within the network type of thing. And then some of the Advantage plans also don't have that geographical limitation sometimes. So, you can check to see what works. There are so many options out there. I think that's where a lot of the issues come in. And so we always say, checking with the the Council for Seniors or Council for Aging. There's always some kind of local organization that really concentrates on that. But we also know enough to be dangerous too. So, but
Isn't that Office for the Aging?
the Office for the Aging. Thank you,
Yeah.
Heidi.
Oh,
I was
yeah.
trying to think of the, the
Yeah.
senior
And
council
they have
on
the
something, but yes,
same-
the Office of the Aging.
They
Yeah,
have that in New York and Vermont as well,
yeah, they have them all over.
everywhere.
Yeah,
So that's, I think that's a federal or state subsidy that pays for them. They're really helpful, and at least the one that we
yeah.
have used in New York. They'll sit you down, you have to make an appointment, and they'll go through all the plans, and they'll put in your prescriptions for you and kind of walk you through it. They can't give you recommendations, but they certainly can provide you with, here are the plans, and you can observe and pick the one that's best for you.
Yeah.
Yeah. And our tool can be of help that way too. There's certainly no obligation to use. In fact, I say our tool, but it's really provided by National Council on Aging.
Is
So
that
there are a
the
lot
My
of good-
Medicare Matters tool, Roberta,
Yep.
that's mentioned on there? Okay, I wrote that down. I haven't
Yep.
seen that one.
And
Okay.
if anyone likes, we can send them the information on that after.
Now you're supposed to sign up for Medicare within that 7-month window, but I'm wondering if you are still working, can you sign up for that, but still not begin paying premiums and stuff until you decide to, leave work or retire or whatever?
No, not really. Although I will say that this is something my next door neighbor came across. She was covered by her husband's healthcare plan, and she turned 65. And so she went on the site, and there was a button or something check box that said, I am 65 years old, but I am covered by a creditable health plan. So I am not signing up now. I'll get back to you when I no longer am covered by that plan, or words to that effect. So I always kind of like to, do that stuff because then I've got some kind of a paper trail.
My mother did the same thing.
It's
Okay.
part of the enrollment process when you enroll for Medicare.
It's online. Medicare.gov. Yep. And you go through the questions. And now that's for original Medicare. Remember, Advantage plans, federal government doesn't interact with that so much.
All right, any other questions? So Debbie, yeah.
You need to unmute, Deb.
Oh, you're on mute.
I was wondering about supplemental insurance, and is that the same as Medigap, or is that something different that covers your copays and things that Medicare won't pay for?
Yeah, nope, same thing. So Medigap, a gap plan, Med Sup, Medicare supplement plans, all the same thing.
Okay.
All the same thing. And again, those will cover expenses that, or they will pay for expenses that Medicare covers, but doesn't pay for. Kind of like the doctor's visit example I used. My doctor visit was $200. It's covered by my insurance, but my insurance isn't going to pay $200. They're going to pay $160 and I pay $40. Well, if it were a Medigap scenario, then I'd take that $40 and go to my gap plan and they pay it.
Okay. And does Medicare Advantage, does the government set those the amount that's going to get paid out to doctors for Medicare Advantage as well as Medicare, or is that a whole
No.
different agreement between private insurance companies and okay.
Yep, you're exactly right. But where the government gets involved is that they make sure that those Advantage plans cover at least what original Medicare A and B cover.
Okay.
And you wonder why this is a confusing topic.
I know, no kidding.
Right? This is why we do this one each year, because there's so much information out there, and they really do want to make it as confusing as possible.
Yeah, absolutely.
Well, it's not a one size fits all sort of scenario.
Very
Everyone
true.
has different needs and lives in different areas of the country, and everyone should check it out for themselves to see what works best for them.
Yeah, and I would also bring you back to the top of this slide on the right-hand side that says start the conversation with Heidi, Christine, and Adam, certainly before you're about to turn 65.
Yeah.
All right. Well, if there's no more questions, I think we'll probably end it here. I'll turn off our recording. I do want to thank Roberta for her time and her expertise tonight.
Thanks, Adam.
We learned so much, and thank you very much for being on with us tonight.
Oh, you're welcome. It was my pleasure. It's kind of fun to do a little chat sort of thing like this too. So
Thank you.
anyway.